how many of you would call yourself geriatric nurses? None of you. I got fresh minds to work at. So you've all heard of gerontology, and we kind of squeeze it in wherever we can in the curriculum. How many of you have a special geriatric class? Oh, you are fabulous. You are just fabulous. How many of you have a special pediatric class? So, you know, we're at the other end of the lifespan, and we are a specialty just like those little kids, and a very broad specialty. So you have kids from 0 to 18, and you have geriatric from 65 to 100 and plus. You just can't take care of them like any old adult. And so we're going to talk about some ways that we could do that. One of the new things, we didn't have to do this before, but so we're going to talk about unfolding geriatric case studies. We're going to talk about ACEs, found out something new at this conference about ACEs. I'll share with you guys. And then we're going to look at some ways that you can incorporate this in your schools, because we're out there and we're not going away. And these nurses need to take care of us. We used to say to nurses, you know, you'll take care of older people unless you go into peds or OB, but you heard about that lady giving birth at 66, didn't you? Don't know why, but she gave birth at 66. And you know how many grandparents are taking care of their grandkids? And what happens if grandma has a stroke? That whole family's a mess then. So we really need to think about how important we are and what we can offer. So looking at, you know, most of what I see in schools that the students are learning, they go to long-term care and they see the sickest of the sick. You know, but these are my friends, and oh, we have a good time. We just have a good time. Now these two men up here are quite ornery. And because of what they were doing, everybody that goes into that nursing home now has to have a driver's test. And they cannot have powered wheelchairs unless they pass the driving test. True story, true story. Racing each other around, almost knocking people down. And so we really need to think about how are we incorporating this population into who we're teaching about as we look at that ACEA, and how are we going to take care of all of us as we get older and have some more needs. So, you know, have you all heard about the geriatric competencies? They're mixed in with the essentials and the LPNs and that, but there are specific gero competencies that you can get off the internet and really tune into what's needed. Do you know who first started this whole geriatric movement? What discipline? It was nurses. Those doctors didn't know what was happening. And it was nurses who said, these people have some special needs. And so they started to look at how do we take care of older adults. Oh, that's me with some of my friends. You know, sometimes we go outing. We were going to a party that day, welcoming some, I don't know, big dignitaries who come around here. And we just had a good time. I wasn't feeling so well that day, so I was in the wheelchair. But I do get out and I get around, and everybody who tours the lab, I think some of you I saw last night. Did you come to my apartment? Yeah. I think I did see some of you. I had some candy out. Not very many people took the candy. I think the sign on the door not to eat in the lab probably scared a few of you. But when you're in my apartment, it's okay. Oh my beads are choking me. Well, this is one of my friends. Well, he was one of my friends. This is Luther Rice. And he was with GW a long time ago, too. He raised a lot of money for GW. And so we do a couple things with our nurses that when they first come in their first semester, they take care of me in a rehab. I had a little urinary tract infection. It happens quite a bit, but it really knocked me for a loop. And so I had to go to rehab to build my strength back up. And so the new nurses coming in, as they're learning, they come and take care of me. They also take care of Luther. Luther didn't have any family, so he has a power of attorney who's a very nice lady who helps direct his care. He's been diagnosed with prostate cancer. And they will see him, they'll take care of him in his first semester, and then they take care of him at virtual hospital. And that's not such a happy time because Luther's disease has progressed, and he's on hospice, and but they take good care of him, and that's what's really important, and do as much as we can at end of life. For me, they take care of me, as I said, in rehab. And when they come back for second semester, that's flu season, really knocks me for a loop. So I'm in the hospital for a little bit, and they get me well there. Then they come, like you did, come visit me in my apartment. By that time, my dementia's kind of kicking in, and they get a little concerned. So they're coming to renew my Medicare services. And sometimes I do get a headache, and so I take a pill. But then I forgot that I took a pill, or they take that bottle from me, but I have backup. And they might take that, but I still have more. And they get very concerned that I keep taking pills. You don't worry, they're really M&Ms. But they have to figure out, they try to take everything from me because I have some good pudding, and I do have a little of the sugar disease. And they take my food from me because that's hard. They've been doing all this stuff in the hospital, and now they have to figure out they can't do that when they're in my house. But they're learning, and so that's good. Now this is a really fun thing to do. This is something you can just give them to do, and when you get this PowerPoint, it'll click on it. When you click on that, it will open it up for you. Don't you love it? It has this really, really nice music that starts to play, and you go in and you have to find all the problems in that lady's house. And they can keep doing it over and over. And it's all about those safety issues. She's just not very good. I think her teapot's in her refrigerator, and there's rugs on the floor and cats running across her. But this is a really easy way to get them to start to understand about what kinds of risk things that can happen to us when we don't get around so well. Now, how many know this one? I bet lots of you know this one. This is just a fabulous site. So they have lots of different things. I heard Cindy mention, I think, consult Geriatric with the Try This tools. How many of you have been doing the Try This tools? Okay, a couple of you. So, the work is done for you. As teachers, don't we have so much to do? The work is done, and so you tell them, this week in clinical, we're going to do functional assessment on your geriatric patients. And you have them go and they get the functional assessment tool, and they read the article and they watch the video. And so I really see students do well when they have something modeled for them, that they can watch it and understand how we apply this. And so when they're in long-term care, we have them do a lot of those basic assessments. But then that carries on because you know who they're taking care of in the hospital. And we'll have them do the sleep study, or as we're looking at transition of care, doing different functional status, ADLs, and those IADLs. My friend was recently in the hospital. She had to have some emergency surgery, and sometimes you think we're making progress. So she didn't do too well, and she had to go to rehab. It happens to a lot of us. But she did get to go home. She went in the hospital when she was taking 2 pills when she went in the hospital. When they sent her home from the nursing home, she was on 11. And the nurse gave her a bag of pills and a sheet of paper that said, you take this in the morning and this in the evening, or whatever. Just a list of pills. Now, her daughter's a nurse, fortunately, because she wouldn't have known what to do. And there were some serious pills on there. There was heart pills and water pills and antibiotics. And, nobody called the next day. She was going to have home health, but she was discharged on a Friday, and they weren't coming till Monday. So, we really need to watch that our students understand. We got to get that transition in care in place. Or we're getting them back in the hospital, right? And we don't want those 30 days. Oh, that's me in my first, that was before I got my new apartment. So they were here visiting me in my community place. She was quite concerned about my medications there. Let's see, Hartford has this care transition toolkit. There are just fabulous things in there that you can just pull out and put to use. Now, one of the new things that I really like, and if you have adjunct faculty come in who go into long-term care, or perhaps yourself, there are 3 modules that, if you haven't worked in long-term care, so when I wasn't teaching, I worked in long-term care, and it's a whole different life and different tools in that. But these modules help faculty figure out how do you make the clinical assignments, what kinds of things students can be doing during their time in long-term care. How many send your students to long-term care first? Yeah. Anybody send them last? Any idea why you'd want to send them last? I mean, I know it's safe and we're all just so cute and, you know, pretty compliant, especially when we're really, really sick. We are complex. Our paperwork is often very different. Getting into, especially if you're in a Medicare or Medicaid facility, doing your minimum data sets and that. But until we start getting our ins in there, it's really hard to get our students exposed to that. You know, they come out thinking their job isn't doing CNA care, and all nurses doing long-term care are push pills. And so there is just so much that we can do if we get some of that more critical thinking in there. I work on it. Okay, so that's your link for Consult Jerry. There's an app for that. So Consult Jerry now has an app. It allows you to do point of care assessments and helps you identify what are the needs and what kind of care plans you need. So you can pull the Try This up in that. Now, we do need to teach the students about how they're using that with all these computers. I still like it when they look at me once in a while. You know, pick their head up away from that. Make sure they're wiping them off when they leave so they're not bringing any germs into me. Well, this is just a pain. There we go. I bet that sounds good. Sorry about that. All right, so this is what you really came to hear about, right? The ASU Scenarios. So how many of you have used these? Oh, all right. Which ones did you use?
Red Yoder.
Isn't he a fine man?
He's my favorite.
Yes, he is a fine man. We used him the first time this year in our community. And boy, he had a bad wound on his foot, you know, that the nurses needed to take care of. So the ASUS has currently 4 scenarios. 4 of my friends are there. And Red Yoder is a gentleman who lives out a little bit in his home. He's a widower, and he has diabetes. And so what happens, and I can't remember what I did here. Nope, that's wrong. Oh, that's a crummy slide. Let's look at this one instead. What happens is you will get a little story from Red Yoder, from all of my friends actually, a little monologue that they do and tell you about their life story. And then with each of the cases, you have 3 separate scenarios that you can have. There'll be a community and an acute care, or 2 communities and 1 acute care. They mix them up a little bit depending on who you're visiting. So Red Yoder's my geriatric friend. And then we have Millie Lawson, and she's a lady, you know, in her 80s. Then we have, not Millie, Julia and Lucy. Anybody know Julia and Lucy? Yeah. This has been one of our most successful ones that the students just really like. And if you were in our blast, you heard about Julie and Millie because she's the end of life. And so Millie, I'm sorry, I get their names confused. I'm sorry. Julia, because that's such an intense scenario at end of life, we don't give that as a pre-assignment. They know they're going to be dealing with something like that, but we all listen to Millie. I'm just that. Oh, I am sorry. I'm not used to this kind of thing. So Julie is, that's an intense scenario and talking about life and death and that kind of thing. So we do that all together, but we give them Red's story beforehand and let them listen to that and have an idea. Everything's prepared and you just pull out which scenario you want. It has everything there for you. And now he's on this, all of the things are on SimPad. So you can go to the SimPad store. I like Laerdal. They loaded it all for me to play with. But all the scenarios are on there. And so you just hook them up to your mannequin and you're ready to go, making it easier and easier on us. So ACEs, what's it stand for? Assess function, coordinate care, use evolving knowledge, and make situational decisions. So that's kind of what those letters stand for. And so much of taking care of us older people is making sure what is it we can do and what we can't do. And I think that's probably what bothers me most about when nurses come in. It's all about what I can't do instead of looking at what I can do, because I still can do a lot. I might do it a little slower. I might want to do it my own way instead of your way. But just give me a little bit of time or give me something that helps me do it. Give me my walker. My friend I told you about, she has one of those long grabby things. She just loves that. She's a little persnickety sometimes and grabs wrong things, if you know what I mean. When we get them into the Trying This series, getting that evolving knowledge, because it's always changing, always doing better. Do you ever talk to your students about an elderly person driving? Is that okay? Well, what happens if it's not? That's such a serious problem. And who is it that has to make that decision? It depends what state you're in. Some states have some laws where elderly have to retake their driver's test and that. But a lot of times it falls on the family. So I had a friend who had that done too. He had pretty bad dementia. And they were worried that, well, he did some things. Like he'd go in somewhere and leave the car running the whole time he was in the show. Things like that, not able to, so his daughter said, we got to take your car away. But he had a really great primary practitioner who wrote the order that said you can't drive. And so when he said, I'm going out, they said, oh, but doctor said, and so that was like really good because it wasn't them getting in trouble. It was because the doctor did. And we do like to, we really believe everything the doctor says. So you can, we're not questioning like those young people. So we have the unfolding case studies. They give you teaching strategies, all kinds of resources. This is just a plethora of things that you can use here. You can use it in the classroom. You can use it in the sim lab, and definitely bringing in these tools into the clinical simulation in the clinical setting. And that's really what we do a lot, is to kind of carry it through all those settings so that we're trying, not have that practice in academic gap, so that students really see what we're doing in lab, they can really apply. Makes it much more meaningful. There they are, there are my friends, Herman and Eartha. How could I forget them? Oh, they're such a nice couple. Eartha has a little bit of trouble remembering things and that, and Herman's just really worried about her. But those are our friends up there. And that's our students. That was long-term care. I don't know if it's because they were happy they were leaving. That wasn't it. They were singing at that time. Oh, resources, because you got to have that. All righty. So let me ask you something. Have you ever heard of the aging game? So we're making some decisions here about this aging game. It's been around forever. You can find some of it on the net. It used to be a published game, actually, that you would take. And the idea of it is you have your students come in and you tell them, you choose an identity of somebody over 65. Okay, what's your name and what's your age? And they put that on a name tag. And then I have a whole bunch of cards out for them with all kinds of jobs. And so they pick a job. I don't know, they like the stripper. And that one always gets picked. But we have, business people. We'll have a postman, working in a dollar store. We have a nurse. They never pick that one. It's quite interesting. Probably a study there somewhere. Anyhow, then we tell them they're in their senior day center, and they're just talking and socializing, and so they're pulling on the elderly people that they've known. And then we have these consequence cards. So, and if you want this, just email Patty, and she'll just send you some of the stuff, because it's all put together. And so some of the consequences are that, you have your check was stolen, and so you can't buy groceries. And when your daughter comes, you're hallucinating because you haven't eaten well, and so she puts you in a nursing home. Okay, that's probably pretty extreme. Other ones would be, you fell and you're not remembering taking your medicine, and you end up maybe in an assisted living. And then there are some who get to stay in independent living. And so we go through a series of these cards. Now, how the game is written is that as they move through these traditional environments, we do what people expect to happen. And so when they're coming into long-term care, we put patient gowns on them. We give them nicknames, so the one who's incontinent's Poopsie. We have Gramps. Yeah, they're not always nice, but the whole attitude is kind of the worst of the worst that you can see in nursing homes. And so after we go through that, and what happens sometimes? Sometimes they read their card and it says, that they're incontinent or whatever, and then, or they fall and they have to get a special consequence card. Those are usually very good because we do have a cemetery set at the side. And so students go to some students, one is that they have been in the long-term care, and I can't exactly remember what happens to them. They've fallen or something, and they full consequence, and they can either stay in long-term care and commit suicide, because you do know males over 65 are the #1 successful suicides. So it's very realistic. And I would say 75% of the time our students choose to commit suicide. So it's very, very telling of what they perceive and interpret on how horrible that is. And then afterwards we sit down and we talk about, what are you getting out of this? And what we have found is, or what we think is, that it's creating the wrong impression. After doing this for several years, we are proliferating the idea of nursing homes being horrible. And having been on that side, and no, it's never the place you want to be, but they really have improved if you can find them. And we're changing our direction on concentrating on how do we give our residents in long-term care independence and choice and sense of community. And so I'm working on changing that so that it isn't that negative, because we really want to promote the direction we want to go to, right? So it's always been very powerful. It's always been well received. We finish it up, and I'm going to ask you this question. So clear your minds, blank them out, okay? Because I want you to think about the first thing that comes to your mind to complete this sentence. All old people. What came to mind?
Aren't old.
Oh, excellent.
Deserve dignity.
Deserve dignity.
Have a wealth of knowledge.
Are fun.
Are special.
Special. Wisdom. We want you all to teach with the students, okay? They smell.
Maintain their independence.
Yeah, we got to get them up and moving. And while it's easier to do, it's just kind of like, especially as we lose our ability to to do things, and you want to do it for us instead of giving us the time. I mean, if you've had kids, and you have that 2 to 3 year old and they're learning to tie their shoes, and you're running late and you got to get out the door, and they're determined to tie their shoes, and you're like, just let me do it. Sometimes if you don't let us do it, we're going to lose it. And so, it does, while it's easier to go in and bathe me real quick and put my clothes on and lift me up and throw me in the wheelchair, I'm losing more and more of who I am and what I can do. And so you need to give me a chance. My students, last time I took them in, I was so proud of them. We had a lady who just didn't move a whole lot. My student was working with her and found out she liked magazines. So she brought some magazines in for her. She had her sitting up and she's turning the pages. And so she says to her, so can you do this? And can you do this? And she said, I can. And she showed her and she said, but don't be telling people I can do that. We just have all kinds. So do you have any questions for me?
Regarding the aging thing, so you're saying that you don't suggest that the aging thing.
I think we need to modify it a little bit. And so I'm going to be working on that. And I just think we really need to promote the positives. Because and it's still, unfortunately, it's like that in some places. But we are gradually seeing the change, and it's the education, and we give in our facility, the patients get jobs to do. So we had somebody who was just into everything as it was, and we made him a greeter. So he now knows everything that's going on everywhere. And so it's just finding and mastering what they can do. We've known that with taking care of our Alzheimer's patients, going back into what their history is and giving them those kinds of things, but really for a lot of our patients. And recognizing these are our sickest of the sick. That's only 5% of our elderly population. 95% are out in the community. And how are we supporting them? And so I think I'm going to be looking more at that instead of bringing in the negative. I think it's time to bring in the positive. Yes?
Is there a standalone course in the GW?
There is not, much to my disappointment. So they get a lot of it in lab.
Okay,
And threaded through, right. So they take care of me all the way through the curriculum. And so they get to know me. And as you can see, we just have a grand old time. Been thinking about getting a Facebook page, but I'm not quite ready for that. They do like to talk through Facebook, so. Any other questions? All right.
The Console Jerry RN app. So so if there was a home health scenario, they could use that app.
They could use it in the hospital because it has the assessment skills in there. And what you'll do is you'll go through the assessment skills and it'll help direct you towards what kind of care needs to be done in that. Right now they have about, I don't know, it's between 8 and 10 different kind of things like falls, and I think polypharmacy is on there. But there is an intent to continue to post more, develop more. And they do like an app. We are no less in doing that. Any other questions? I think we're at about 5 minutes or time. All righty. We like that pill card too, if you were in the other session. So lots of pill cards for us. Our students have used that in discharge planning, and that would have been nice if my friend had that with her 11 pills. The other thing that happened to the same friend, I can't remember what she was put on, like an amiodarone, or I don't know, something like that. And they gave her the Mosby printout. And this is a non-medical person, and so she was supposed to understand all that stuff. So we not only need to look at people's literacy, but health literacy and computer literacy as we're moving into all that stuff. It just keeps changing. It's fabulous. Well, thank you so much. I think we're almost at the end. I think I kept you awake. That's good. That was my goal after lunch and 3 days of hearing people talking. So you enjoy the rest of the time, and hope to see you about. Well, good to hear. Good to hear. I've learned lots from our vendors, lots from everybody who's spoken and networking and all those kinds of things. So be looking forward to next year. Thank you.